You can come on.
Hello everyone. I would request everyone to please be seated down. Let's start the event. Hello, Assalamu alaikum and good afternoon everyone. I am Rabab Fatma Naqvi and I am the lead for non-invasive technology here at Tech for Life Enterprises. And also I'll be your host for the day, so you'll have to bear with me the entire event and hopefully I'll not bore anyone of you. Also, you'll be seeing many of my team members here catering different responsibilities of the event today, and that's actually a reflection of how important this event is to us and how we want to put forward our hard work and the technologies that we have in front of our guests. So on behalf of Tech for Life Enterprises, I welcome you all to our seminar titled Telemedicine for Enhancing Flood Response and Improving Preparedness of Health Systems. I would like to formally commence the event and request everyone to have their cell phones on silent so that the event can go uninterrupted. I would firstly welcome our senior biomedical engineer, Mr. Abdullah Raza Khan, for Tilawat al-Quran.
Thank you, Bob. Assalamu alaikum to everyone. I will need your kind attention towards the citation. أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم والعصر إن الإنسان لفي خسر إلا الذين آمنوا وعملوا الصالحات وتواصوا that by the time indeed mankind isn't lost, except those who have believed and did righteous deeds and advised each other to truth and advised each other to patience. Thank you. Over to you, Bob.
Thank you, Abdullah. So I think with this blessing, I would like to introduce Tech for Life Enterprises to all our honorable guests here. A little peek into the history of Tech for Life. A lot of health issues globally and also the parallel advancements being made. Everyone here can agree with me that health providers still struggle today with a variety of problems related to accessibility, availability, and the affordability of required tools, uh, healthcare system, and also the infrastructure to provide best care to the community. This is where I can proudly say that Tech for Life Enterprises has put their best foot forward and to contribute and deliver an advanced healthcare system to reach every household and within that every patient without any barriers and ensuring that we provide quality telemedicine solutions regardless of the location and also the socioeconomic conditions of the locality. Moving this event further ahead, and I would like to boost up your spirits by introducing Mr. Amin Hashwani, and who has been an integral part of Tech for Life Enterprises. We are fortunate that he has been aboard since the very beginning. Mr. Hashwani is our director and advisor for business development. He is a businessman and a social activist and has founded and to date continues to support various social initiatives in the fields of education, health, youth, development, culture, and he is the recipient of several international and national awards and accolades for his work, including an honorary doctorate. I would like to welcome him upon stage for the welcome address.
Good evening and strong to Madam Minister. Thank you so much for coming. I know you just arrived and you barely adjusted to your jet lag, but thank you so much for being here. I'll be very brief. Let me start with the quote from Winston Churchill. He said that by the time when you're 20, if you're not a socialist, you do not have a heart. And by the time when you're 40, if you're not a capitalist, you don't have brains. I think in our case, it's been the reverse. If you're not a capitalist, you don't have brains. I think in our case, it's been the reverse with age rather than capitalist. And our association with Tech for Life and Dr. Shari Khurra, I still remember the day he came with the audacious ideas to transform the global health landscape. We thought it was a bit of a crazy idea, but we really liked it. And it was really about saving lives through technology, and our mission still continues to be socialist driven primarily, and we always have our discussion. So that's what it really motivates us and makes us really exciting. There's some pretty exciting stuff which is doing. Pakistan, like all developing countries, has huge challenges in its socio-economic sector. What makes Pakistan stand out is that socio-economic indicators are actually worse than other competitive countries in our category. And while in the cities you have this disproportionate philanthropic endeavors by the civil society that keeps the indicators better in our cities. However, in the rural area, this situation is a lot worse than these statistics say. And we blame politicians, we blame government. We do have not only resource constraints, but we also have governance issues. There's capacity issue. Even if we have the resources, it's very difficult. Hence, if we want to make any meaningful impact, especially in our rural areas, we have to look at technologies, innovative solutions, models, etc. Sim government, I must say, I do give credit to them for thinking out of the box in a lot of ways, even in the education sector, with the public-private partnerships, and they've been very, very forthcoming. There are professional teams that are working, even in the health sector. They have done public-private partnerships that work wonderfully well. And so, with that, Madam, I'd like to acknowledge all the effort in this direction, and also working with them to enhance the impact. So, hence, I think with limited resources, you need social innovation. In business, the Silicon Valley, you keep on trying innovation, fail, try again, and keep on. If we do not do that, we will not be able to make disproportionate impact with limited resources on the ground in the health sector. Hence, technology, innovation, partnership, all of that is an integral part if we want to, make a meaningful impact. So thank you, madam, for like, I know we've had several discussions and you've been more than forthcoming in this sector. So with that, I just wanted to set the context. Thank you very much.
Thank you, Mr. Hashwani. And I think the line that you said that with limited resources we acquire innovation. So I think as an engineer, I cannot much stress upon this line, and it's very overwhelming to see that innovation and research is now being recognized in our country. So now moving further ahead, and now we'll be shifting the gears and the momentum to the most engaging and interesting part of our whole event, and that is the panel discussion titled Telemedicine and its Impact on Healthcare and Disaster Response in the Light of Flooding that has unfortunately affected our entire country. This discussion will be headed by my team member and colleague, Mr. Ehsan Abbas, who also is the head of sales and marketing. I would like to welcome him upon here. I would like to have a little bit of enthusiasm from the crowd here. If we can have a round of applause, please.
Thank you, Rubab. Assalamu alaikum, everyone. My name is Ehsan Abbas, and as Rubab has mentioned, I am working at Tech for Life Enterprises in the Sales and Marketing Department as the head of Sales and Marketing. It's a great pleasure for me to be here amongst all of you, especially Minister for Health and Population Welfare. Thank you, everyone, for coming in. And I'm going to be hosting this panel discussion, which is on telemedicine and its impact on healthcare and disaster response. So we definitely need to talk about a little bit of background while we are having this panel discussion. As you are all aware, how our country was badly affected by the flooding earlier this year, and as per the National Disaster Management Authority, nearly 1.8 million homes were affected by the flooding, and the floods washed away roads and damaged nearly 400 bridges. Also, more than 500,000 people were left homeless due to that flooding. And also, at one point, nearly a third of our country was underwater. So, with massive relocation and severely damaged infrastructure because of the flooding, essential services such as housing, education, and healthcare got severely affected. So, this is the background why we are having this discussion today on telemedicine and its impact on healthcare and disaster responses. And to have this productive discussion, we have invited expert panelists from the government, from the NGO, and also from the private organizations. So please allow me to introduce our panelists. Our first panelist is from the Sindh Healthcare Commission. She is a medical graduate from Dow Medical College. She has also done Masters of Science in International Primary Healthcare from UCL London. She has also done Masters in Public Health from DUHS. She also has a diploma in Health Professionals Education from the AKU. She is currently working as a provincial level deputy director in the Directorate of Clinical Governance and Trainings with a special focus and key function of developing regulatory standards and processes, as well as to train healthcare establishments on the quality standards. Please give a warm welcome to Dr. Zainab Hassan. Dr. Zainab Hassan, welcome. Please be seated. Thank you. So moving on to our next panelist, he is from HANDS organization, HANDS Pakistan. He is a public health professional and he is also a reform enthusiast with a career spanning over 20 years. And he has a great experience in public health, healthcare policy and strategic development. He has a PhD in public health and he has been able to bring about structural reforms and innovations in both public and private institutions and regulations. He has also worked in various leadership roles. He has also been associated with some various projects with WHO, USA, PFID at both country and international regional levels, which also improves ID at both country and international regional levels, which also improves experience of working in the developing and conflict regions. Please put your hands together for Dr. Ehsanullah Khan. Welcome, Dr. Ehsanullah Khan. Please be seated. Thank you. So our next panelist is from the group CIO in this hospital and health network. So it's a great pleasure to speak about him because the interesting thing about him is that he is like the pioneer member and the first ever employee of the Indus Hospital. He's an IT professional with over 34 years of experience, and he has a special focus on health informatics. He has some great honors. He was like shown on the cover page of First CIO magazine in 2008. He's also a recipient of prestigious award of the ICT Best CIO Private Sector Pakistan in 2009. He also was awarded at the Global CIO 200 Forum with the title of Master in 2020. He also received the title of Legend in 2021. So he has also received Best Innovative Idea in Pakistan Award in year 2016. Please give a warm welcome to Mr. Shakil Akhtar. Welcome, Mr. Shakil. Please be seated. Our next panelist is from the Aga Khan University Hospital. He is currently working with the AKU as the Chief Operating Officer, Secondary Hospitals, Pakistan. He has been associated with AKU since 1992. He is also a certified quality professional from QPSP, which is Quality and Productivity Society of Pakistan. He is also a certified quality manager from American Society for Quality, certified professional healthcare quality from certified professional healthcare quality from USA, and ex-international physician surveyor for the Joint Commission International Accreditation USA. He has also served as the vice chairman and chairman of QPSB in the past. Please welcome Dr. Sayyid Mirazuddin Shah. Welcome, Dr. Miraj. Please take a seat. Okay, last but not the least, this panelist is from a very important association, which is the eHealth Association of Pakistan. He is a founder member and president of eHealth Association of Pakistan. He's a medical doctor, also obtained his PhD in clinical biochemistry from postgraduate medical school London at Pakistan Institute of Medical Sciences. He also had a great interest and experience in developing and implementation of electronic medical records. Please welcome. And I have to mention that Dr. Harun Khan has come all the way from Islamabad. So, Dr. Harun, we welcome you here and hope you had a good journey because he has just arrived earlier today. Thank you to all the expert panelists. So now we have all the expert panelists and we are going to have a panel discussion on the aforementioned topic. So now we are going to have two rounds, and in each round, each panelist will be asked one question. And we will start with Dr. Zainab and then to Dr. Ehsanullah Khan, so on and so forth. One question will be asked in the first round, and then we will have another round with second question for each panelist. Each question will be specifically tailored for all of you. And then after that, once we are done with that session, it will be followed by the live Q&A from the audience. So this is how our panel discussion will operate. So now I'm also going to take a seat over there and we will commence our actual panel discussion. Thank you. All right, so having introduced all our great expert panelists who have come from different organizations and who have great expertise and experience in the field of digital health and everything, especially in the light of flood response and disaster management. So we are going to start our first round with the first question for Dr. Zainab Hassan from Sindh Healthcare Commission. So Dr. Zainab Hassan, my question for you is in the light of disaster management, could you please educate us how regulations and policy can strengthen the service provisions and also add quality dimension? Thank you.
Yes, so the regulatory policies and frameworks, they assure that there is an increased likelihood of the desired outcome. So wherein in quality we say there is safe, effective, efficient, timely and equitable care and patient-centered care, which are the different dimensions of quality. So when we have the guidelines, then it is easier to establish new teleservices and digital services as well as to expand upon existing services, which in disaster response is very important sometimes. We will not know when the disaster strikes or what the scale is going to be. So when we have these regulatory frameworks, they do become like a guiding principle to expand the already existing services. And when the services they are licensed and accredited through a regulatory body, then they increase the patient trust in the facilities that are being given. A very important the issue here is the validity of the digital diagnostic devices and all the services that are being provided. So when there is a regulatory framework and the services have been licensed and accredited through those regulations, then there is an increased likelihood that not just the quality but the all the digital systems they are valid and whatever if they are put to use they are going to be very much dependable for all the physicians. Then there, across the globe, as we see, there are, we were doing this literature search and they are still developing these standards for the, what you just call the virtual care industry. So such standards are still in process. We looked at Australian standard, we looked at US, we looked at UK. COVID did a very big thing for us, that it just gave this big leap to this industry. So I want to thank the medical Since is the first province that has cleared its Telemedicine and Telehealth Act in the December 2021. And following that, Sindh Healthcare Commission is inshallah going to be hopefully become the first regulatory body in Sindh that we have started our work, initiated our work on developing regulatory standards to register and then regulate and license all the services in the telefield and digital field. And this is going to be a stakeholder collaboration. We will all have to work together to that, and we are going to need it to be sufficiently dynamic so that we can accommodate the rapidly changing pace of technology. Because even since we started work, things have changed quite a bit.
Wonderful, wonderful. Thank you, Dr. Zainab, and best of luck for your initiatives and your endeavors. And now we are going to move to Dr. Asanullah Khan from HENS. So, Dr. Asanullah, my question for you is related to the flood hit communities and the initiatives that you took. Because HENS has been involved in a lot of flood relief initiatives and work in both provinces of Sindh and Balochistan. So, could you please shed a little bit of light on that?
Thank you so much. Thank you so much. It's a worthy and very respected audience here. You know, floods actually unearthed those difficult questions of access, and we saw that during the floods, many rushed, and so was hands in the field, and especially the districts that were affected, both in Sindh and Punjab, of course, in Balochistan and